Hello, good morning. Welcome to the Master Plan for Aging Equity Work Group. This is our third meeting. I'd like to go over some logistics for this morning. As you can tell, we are meeting by webinar and phone only today. Thank you again for joining. And we will have a public comment session. Next slide. At the end of this meeting, there'll be 15 minutes set aside for public comment, and I'll review these instructions again later when that time arrives during the meeting. I'm going to go ahead and turn it over to Kim McCoy-Wade, the Director of the California Department of Aging.
Welcome. So wonderful to see so many of you, your name and your picture where we can. Welcome back. We've got about most of our equity work group here. I see the numbers counting, and 23 members of the public calling in as well to participate and listen. So thank you all. What I'm going to do is kind of set the table for the meeting. But before we do that, Amanda, would you mind doing the roll call, please, of the equity work group members?
No problem. All right. So I'm reading down our participant list here. I have Cheryl Brown.
Here.
Derek Lamb.
Present.
Thank you. Kiara Harris.
Here.
Marcy Edelman.
Here.
Rigo Saborio.
Here.
Thank you. Let me move here. We have Catherine Blakemore.
Here.
Cheryl Brown. Donna Benton.
Here.
Jeffrey Reynoso.
Here.
Kevin Prinville.
Here.
Leandra Clark Harvey.
Here.
And that is everyone showing up on my screen. If I did not call your name, could you please raise your hand? And we have Linda Tenerowitz. I see you. We need to move you over to the panelist side. And Bernice Nunez Constant, I see you. We need to move you over to our panelist list.
Hi, this is Edie. I'm here.
Hi, Edie. Any other? Okay, I believe we have everybody.
Thank you, Amanda, and thank you all.
Really quickly, sorry, this is Karen Lincoln.
Yes.
Karen.
I'm unable to raise my hand, or I don't have any functions on this end, sorry.
That's okay. That's exactly what you do is you raise your voice. Thank you very much.
You're welcome.
So welcome. Let me again set the table for our third equity work group for the Master Plan for Aging. I'm going to spend a couple minutes kind of bringing us back to the Master Plan for Aging, since we relaunched on Monday with kind of the new timeline, the new context. And we really have three goals for this meeting that we'll tackle in order once we kind of have that common foundation set for all of us. One, we want to have a discussion and hear from you about this moment, about COVID, about systemic racism, about the lessons for the master plan that the moment is demanding of all of us, particularly around equity. And so Rigo Saborio is going to facilitate that conversation with us. I should say our co-facilitator, Carmelita Terzi, as so many of us, was hoping to be here, planning to be here until last night, and then she had to deal with a personal situation which will be okay, but she had to deal with it. So I know all of us are pulled in many directions, so we will miss her, but we will carry on. The second thing we want to do, besides after grounding us in this moment, this challenge, and this opportunity, is get to work on two of the deliverables that the master plan is seeking from this group. One is the equity tool, which really a lot of work has already been done. It has been informed the long-term services and supports subcommittee work, and it has, I used it yesterday with some colleagues at the Alzheimer's Task Force, and I think we'd like to make sure it informs all the other master plan work groups and subcommittees who are working hard this summer. They have summer homework. So see if we can finalize or make a plan to finalize the equity tool by the end of the month, which I'm here to tell you is Tuesday. And then the third and final piece is the equity recommendations. how those will be developed and how those will be informed. And we can talk a lot about that. Again, I'll give you a spoiler alert that the deadline for that is going to be the end of August. So there's time, but we want to make sure we leave here today knowing how the group is going to work together and move towards equity recommendations to bring to SAC to advise the administration. So those three goals, really grounding ourselves in the moment that we're in with COVID and equity and racism, driving to a finish on the equity tool for this month, and setting up a process for equity recommendations for the end of the summer. Anything else you're hoping to accomplish or do today in our tight 2 hours? Okay, then next slide, and let's just, I almost feel like it's welcome back to master plan. Guess, of course, the COVID work continues, and of course, master plan continue to advise and inform the COVID response. But if we can go to the next slide, if you take away nothing from this busy slide, let me tell you three things. One, we're kind of adding 2 months to the timeline. As you may remember from the executive order, it was due October 1st. Since the COVID pause was about 2 months, between early March when the stay-at-home order came and that meeting we all had, the SAC had, the Stakeholder Advisory Committee, in late May to kind of reconvene, was about 2 months. So December is that final box, the MPA, be released by the administration. What that means is that we are going to have 2 meetings in August and September where we receive the final recommendations from all of the many work groups. Maybe what I'll do here is go left to right. So we started in last June, if you can believe it, about a year ago, June 10th. In the fall, we're really beginning to engage the public, engage the stakeholders, form our work groups. And then by March, we had the recommendations from Goal 1, the Long-Term Services and Support Subcommittee. And those recommendations came from the subcommittee, went to the full SAC, and have been received by the administration and will be incorporated into the master plan. Now we need to do Goal 2, Goal 3, Goal 4, equity, research, and Alzheimer's. So we are setting up Goal 2 and Goal 3 to be heard at the August 11th meeting. So they have their homework and they are at work. And we're setting up Goal 4, research, equity, and Alzheimer's for the September meeting. What's important about this is 2 things. We would like the equity tool to be finalized, and it is really, I'm eager to hear the discussion today, but it is very far along. There's been a lot of work, a lot of thought, a lot of discussion, both by all of you and by Carmelita, Rigo, and Kevin, to finalize that tool as quickly as we can, ideally by June 30, Tuesday. And then we can give it to all the subgroups who are working all this summer so that they have it to do their work. And then this group could come and present the tool to kick off that first meeting. I want that tool to ground all of our meetings in August and September, so to be presented at August 11th. So that's the second thing. So the first thing is the final deadline is December. The second thing is the tool deadline is ASAP so that we can use it all summer with all of our work groups and present it at the August 11th. And then the third piece is that September meeting. We anticipate and invite and are counting on this group to have specific equity recommendations that are cross-cutting. Just as equity should infuse all of the subject areas, we also expect to see equity recommendations that may be cross-cutting. Could be on training, it could be on translations and language services, it could be on partners, it could be on many of the issues that have come up. So we want to be sure this group is engaged and ready to produce those by the end of August and bring them to September SAC. So we'll talk about all of those items in each of the agendas, but just wanted to kind of ground you in the process and the cycles and make sure if there's any questions. You'll notice September 15th is the last SAC meeting, and then what happens is the administration, the cabinet work group will be writing and finalizing the administration's master plan, reflecting all of the input, and again, aiming for that December 2020 release. Let me pause there because this was all just released on Monday via email. You're the first to hear it. This is the first time I've practiced saying it, so I'm sure I can say it clearer and cleaner. The Engage website is being updated. The agency master plan website is being updated. So hopefully this process of lots of public and stakeholder engagement this summer, finalizing in SAC August, September, and the administration finalizing by December begins to be better known and understood. Any questions about just the mechanics of the timeline or concerns?
Kim, I just wanted to add that clearly we obviously you're speaking to goal 2, 3, and 4, but clearly already the committee has been heard, and much of what was shared and recommended to the members of the long-term source and supports committee was actually received and integrated into the report. So I just wanted to underscore that our work is already having an impact. And so I think the timing, again, just as resetting the table and reminding us as we're coming back together, we did come sort of a little bit later in the process, but the timing was still good, and that we're already making an impact. So I just wanted to share that with everyone. I think most people know that, but just want to remind folks that we've already had an impact.
And I guess the other thing I would share is that we are also trying to acknowledge that people are stretched and stressed, and in new ways right now, and in old ways as well, in old and new ways, and that we are trying to make the process both collaborative and deliberative, but also streamline it and acknowledge that we're just in a different world. And so, and also we're all virtual, right? Remember last time we met, we wanted to be together in person all day long. So we're changing how we connect, and we're trying to be more mindful and make sure this is not an additional workload, additional burden on everybody in tough times, but it's really essential and vital work. So we're very open to how we get the work done in a way that is sustainable and not contributing to burnout that I know many people are struggling with in these days. So that's another attempt we're trying to do. So this is a 2-hour meeting instead of a 4-hour meeting, but again, this will be a constant learning about what's the right way to get to the right place. Okay, with that, I would like to turn it over. Let's see, the next slide, I believe, is oh gosh, I didn't brag about you enough in print. So that to Rigo, did you do this on purpose? Look at the accomplishments to date. We were formed in February by Rigo and Kevin asking the SAC to do that. So met in February and developed the purpose. You developed the questions. As I mentioned, the tool is very far along, and you informed the LTSS subcommittee, and you also advised CDA very much on the COVID response in terms of our ability to move into more languages. Most of our print work was in English, Spanish, and Mandarin. Our first ever conference caregiver calls in English, Spanish, and Mandarin. And of course, our more of our advertising of the resource card, we were able to do radio ads in Spanish and 7 Asian languages, and LGBTQ newspapers, and Facebook ads targeting Latino and Native American elders. So more trying to get deeper into the community, although there's more to do. So very much informed and influenced, and of course getting more equity data about COVID posted on CDPH's website and shared out, which they of course are leaders in and partners in that work. So yes, Rigo, to your point, much has been done in 2 meetings and 5 months. Next slide. And what's ahead, we just talked about the equity tool questions, in continuing to inform the SAC research subcommittees and work groups. Many of you have joint membership, and we'll talk about that. Providing the equity recommendations at that September meeting. Continuing to consult with us on our public engagement. We've got some ideas for July, particularly around the ageism event with Shireen McSpadden. And a tentative meeting in August to wrap up our stakeholder work on equity and think about the future of equity and aging. So as I said, it's much to do, but we're committed to do it in partnership. And I guess, again, as I transition, Rigo, to hand it off to you to talk about COVID and the systemic racism and the protests and the moment we're in, just do want to say thank you for all of the feedback on priorities that you shared during COVID. Again, that increase in outreach to multiple communities, the expanding data indicators, our new digital divide project, which we've just launched, Started with 2 webinars featuring groups from San Francisco and San Diego, and looking to do much more in this space with our AAAs and other partners. And again, looking to do more on isolation and engagement overall, the friendship line expansion, April 15th being one key piece of that 24/7 warm line to call when you looking for to chat. Several hundred calls a day still continuing to come into the friendship line. So thank you for all of your priorities helping us set our priorities. Next slide. So Rigo and Kevin, again, without Carmelita, I'll hand it to you to kind of create this space to listen and learn. You did this for us at SAT, kind of sharing from the field and from your own professional and personal experience where we are, and bringing that forward to the group. So I will literally lean back and let you lean in.
All right, thank you, Kim. And certainly to my esteemed colleague, Kevin, please feel free to chime in with any thoughts of your own to sort of kick us off. But we certainly wanted to sort of take a moment before we dive into the equity tool question and the recommendations, to really give ourselves some thought to reflect as to what's been happening around us. And in particular, we want to hear from you. Obviously, since we last talked, we were already experiencing quite a bit of a stress from COVID. And unfortunately, what we've seen is a continued surge in the numbers. But as we are experiencing COVID-19, we've also since then have experienced the Black Lives Matters movement, and certainly has risen and strengthened. And both of these sort of intersect between these two, have really clearly shined a light on, as Kim pointed out, systemic racism and inequalities and inequities. And so that said, we certainly want to hear, what your experience has been, what your thoughts are around this, and perhaps more specifically, how have these two significant, COVID-19 and Black Lives Movement, and, sort of how have they played into your mission of your organization, as well as into the social and health inequities that we've already been addressing over time. So, and I think, if we have time, I think importantly also, what's as we reflect, is how can some of these thoughts and lessons be applied to our work moving forward into the master plan. So I'll stop there and see if Kevin, if you wanted to add any particular thoughts, and before we have the folks on the work group respond. Can't hear you, Kevin. Not sure why.
There we go. I think that should do it. So thank you all for being here today, and thanks, Rigo, for setting us up here. As you said, I think you hit it on the nail that we're living at this intersection of these multiple pandemics, one that's newer and one that's existed for a long time. And we're seeing how the Black community in particular is being impacted by the intersection of these pandemics. But also other populations too, that are communities of color, racially diverse communities. But I think particularly in this moment of the intersection between COVID and the Black Lives Matter movement, we're seeing drawn into stark contrast, something that I think a lot of us have seen, but are seeing in just a really powerful way now. Some data came out from CMS this week about Medicare beneficiaries' experience with COVID, and that data showed that dual eligibles, particularly Black dual eligibles, are really a community that is disproportionately impacted by COVID in a severe way. And we've talked about that it's the health disparities and people with health disparities that are vulnerable of COVID. And I think within this Black Lives Matter conversation we're having nationally, we see that the disparities are linked to systemic racism. And for older Black people, it's the decades of experience in that system, in our inherently racist systems, that lead to these health disparities and are leaving those communities more vulnerable at the time. we've taken that at Justice and Aging as a further challenge to center our work in equity, to think about policies that aren't, policies we need to advance that aren't race neutral, that don't happen to impact Black older adults and other diverse older adults more, but actually what are the policies that are going to explicitly address the systemic racism that has existed, that continues to exist through people's lifetimes, as well as the experience they have when they're older. And so I'm really interested to hear from our whole great work group here about how you're thinking about these things, how you're experiencing this on a personal level and on an organizational level, and then how can we collectively identify those policy recommendations that really are getting at root cause and are really explicitly designed to help the communities that our group was formulated to focus on. So not, again, that since we talked about from the beginning, not as an afterthought, but as the center of our thinking. So I'm excited to learn from you all, to partner with you all as we move through this really, difficult time, but also a time that presents an opportunity for us to have some conversations and to think about things in ways that maybe not all of us have been fully ready for in the past. So appreciate this opportunity.
Thank you, Kevin. So I think the floor is open to any and all. So anyone like to share their thoughts, feel free.
Yeah, this is Derek Lamb, part of the work group and the stakeholder advisory committee. So just want to share with everyone that this issue is really close and dear to the heart of ACC Senior Services. And since the Black Lives Matter movement has started, again, this recent weeks, we have actually held a couple of town hall meetings with our staff members and to learn from them what's the impact on their lives personally and also professionally, because ACC Senior Services, even though we started as Asian-based organization, we have really diversified our workforce and also people we serve. And also most recently, I published an article on our website and also on our Facebook, basically addressing this very issue and asking people to think in terms of not to treat people the way we want to be treated, but to treat people the way they feel like to be treated. And ask people to also look at several questions. So how can we help, people from different races and ethnicities obtain justice? And how can we do to reduce implicit biases, racial injustice, and inequity in our institutions, not just law enforcement? How can we protect the rights of our citizens regardless of color, race, ancestry, religion, sexual orientation, age, or country of origin? And what can we do to invest in our community to educate our young and old, fight racism, and give would-be victims new life-changing opportunities? So we are issuing also a quarterly ACC newsletter, which will be disseminated to 10,000 people on our list. It's a way to communicate this very important message. So this is what we do at ACC, and I think it really ties in very nicely with what this work group is trying to accomplish as well. Thank you.
Thank you, Derek. Anyone else?
Hi, this is Karen. I'll chime in. So first of all, I appreciate this group even more so than I did when, in the very beginning, and I had a great appreciation at that point. Just overall, I think that, it took a global pandemic and I think the Black Lives Matter movement, the resurgence of it, at least more visibly globally, to have a conversation finally about African Americans. And, I wrote a piece in the Wall Street Journal, and I started it off with a rising tide sort of, raises all boats. And with the point of that piece being, focusing on African Americans in particular is helpful for everyone. And I think we are all of a sudden, it seems, becoming aware that there are Black people in this country, that systemic racism exists. And, we've We've talked about other groups, targeted outcomes, and targeted efforts. I haven't seen any that have been specifically targeted to African Americans. And I think oftentimes, because we speak English, we're not sort of subsumed under the idea of cultural linguistics and et cetera. And so our work at Advocates for African American Elders has really been focused on translating some of this English into language that we can actually understand and access because of health literacy issues. Trying to strategically understand how to encourage and actually engage in social distancing when you have, say, multiple generations living in a home and you have essential workers going in and out, getting your hands on, PPE and disinfectant. So what we ended up doing was partnering with a social service agency, particularly the WLCAC, which is the Watts Labor and Community Action Committee, that serves a very wide range of older adults in the South Los Angeles area, and asking, what are the prominent needs? And what they identified was it wasn't food. It was actually hygiene products. And so we used our funds and got donations and created hundreds of hygiene kits, because a lot of our seniors were rushing to the grocery stores only to find the shelves empty and weren't able to get their hands on disinfectants, and Clorox was all gone and wipes were gone, and there were no gloves, of course, or masks. And so we were able to fulfill those needs. And we worked with our community agencies for them to help us identify the most severely impacted older adults. And so we were able to distribute these kits that came in on pallets, and it was just a huge effort. So we were very happy to sort of shift our focus from the research and education and outreach that we had been doing to meet these very basic needs. And sort of what has come out of that is, really being able to say, we've been having these conversations for a long time, but we really need to highlight the needs of, African Americans in our communities that don't get a lot of attention. More recently, I think, we have, but the reality is these issues are not new for us. It's no surprise that African Americans are dying at higher rates, even though the infection rates are lower, right? So once it enters our community, the death rates are very excessive, and there are reasons for that. And it has a lot to do with systemic racism and social and structural vulnerabilities that we don't take into account, because I think we're missed when we talk about underserved communities, particularly with the language and the linguistic focus. So I just wanted to sort of impress upon all of us that English is something that we do understand, but it doesn't always translate to access for many of the content and messages and health communications that we're receiving on the television. And of course, we're not getting a lot of that information via internet because broadband access is extremely low. Only 38% of African Americans actually have broadband access, older adults. So, just in terms of how we can accommodate the lived experience and living situations of many African Americans who are finding it very difficult to engage in the prevention strategies that have been highlighted by public health officials. And, how do we then sort of translate those strategies into actions that people can actually engage in to prevent the COVID sort of virus from spreading in our communities?
Hi, this is Kiara from Sisters Aging with Grace and Elegance, and I want to ditto what Karen is saying about the African American community. And what we're seeing at Sisters Aging with Grace and Elegance is that the older Black women that we serve are feeling less safe and having the need to come together more often as Black women to discuss, mental health issues primarily are coming up for a lot of our population, just not feeling safe and worried about family members, and all the things that are happening now are creating a great deal of stress. In addition to the police shootings and now the the hangings that are being found in California and other states is just putting a lot of our population in fear. So there are some organizations, at least one I'm aware of in Sacramento, that's called Safe Black Spaces. And it is African-American mental health practitioners who are holding meetings, of course, virtually with African-Americans to just talk about emotions and how we're feeling during this particular period, both with the pandemic and people being sick, and the higher rates of death in our community has been a real challenge, not being able to mourn collectively as a community, but to bury our elders without them having any contact with any family members has been very traumatic for our population. So we're seeing a rise in mental health needs, but then the comfort level is with other African-American practitioners, and that's not easy to find. Even myself, I looked for an African-American Medicare practitioner, and it was, you know, a needle in a haystack. And a lot of our elders don't have the tools to even do all the research to find the practitioner that they're looking for. So we're doing a lot of community building around the issues of mental health, as well as technology, because we've had to spend quite a bit of time with our elders, teaching them how to use their phones and their laptops so that they can even get on these calls to get the services that they need virtually. So the technology, the inability to grieve in community, and the lack and not feeling safe has been really difficult situations for older Black women. And also to what Kevin said, we really do have to deal with the cumulative impacts that racism has had over the life of older Black men and women. So I hope we can take that into account in whatever the master plan is going to address. I think it is a necessity to explicitly address systemic racism as an issue that is impacting the health disparities for the African-American community. We can't sugarcoat it, we can't gloss over it. We have to use the words and say systemic racism is causing these problems, and then we have to find ways to address it. Thank you.
This is Liana.
Yes, go ahead.
Hello?
Go ahead.
Okay, I'm sorry, I was hearing some feedback. So I really appreciate and echo the comments that were just made about mental health and behavioral health, substance use disorders, as well as they impact everyone during this crisis, particularly the African-American community. I represent community-based organizations that provide those services, and what we've been seeing is that before folks can even really focus on their mental behavioral health issues, they just need their basic needs met. And so what our agencies have done for the older adult populations is gone to their homes and, you know, dropped off groceries and then knocked on windows and really provided those services through the window, because there has been difficulty that we've seen with people accessing telehealth. Though it's been great and a lot of our clients have received services through that modality, we've still had a lot of trouble, particularly with vulnerable populations. And on top of that, you know, folks like African-American populations that access to broadband was already mentioned. And so, you know, I'm heartened to see what providers are doing. At the same time, you know, the comment about not having enough providers that represent the diverse population, that's real. And I feel like, if anything, this COVID-19 situation has just exacerbated the inequalities that already existed. It's really kind of brought things to light that we knew existed, we talked about, but it's really highlighted them. And I feel like it's time for us to take advantage of the opportunity when there's so much focus on these issues and they're impacting everyone. To not just talk about it, to not just write about it, but to look for action steps as well. You know, I'll say as an African-American woman, you know, has experienced definitely a lot of, you know, different things that have happened, you know, across, in our nation across time. And this is not the first time that there's been these types of injustices and inequalities played out in this way. But what is different this time, for me at least, is the way that allies are responding. I've never, you know, there's been shootings and murders and all types of things focused on Black people, but the way that our allies have really stepped up to the plate, I really feel it's as if everyone's asking in unison, what can we do? And so this is a really critical time to answer that question. Thanks for letting me share those thoughts.
Thank you, Leandra. Anyone else like to add any comments, thoughts?
Hi, this is Edie.
Oh, Edie, yes, go ahead.
Oh, well, yeah, I work at the Alzheimer's Association, and we had scheduled a session early on before the death of George Floyd, but it's called Caregiving While Black, and really looking at the intersection of race and cultural context of caregiving for someone with dementia. And what's really come to light more and more as people feel the need to really speak out is how, you know, wandering is a major issue for people with Alzheimer's. And we had a couple individuals share how, you know, one woman, her husband has Alzheimer's. He's an African-American man. He was wandering. She or a neighbor called the police to get help, as we usually recommend families do. But in this instance, he was getting agitated and he was arrested. And it took her a year to clear that from his record. And on top of that, they had a $10,000 bill to have to take care of. And, you know, so I think there's an opportunity for us to really look at, you know, what are some policies that we can influence here. For example, I think we do have a bill proposed on that all first responders be trained in Alzheimer's and dementia. But when things like this happen, and this is not the first time, the families really worry. And for African-American families, caregivers, they are not going to go to the police first when they need help with their loved ones. So just wanted to share that.
Thank you, Edie. Anyone else like
I
to?
think Cheryl's trying to speak, but she's muted. I don't know if there's a way to unmute Cheryl Brown.
Cheryl, can you unmute yourself?
Cheryl, there should be a mute button at the bottom left hand of your toolbar.
Okay, I found it.
Yay.
Now, the thing that I would like to say, and there I am. Okay, the thing I'd like, can you hear me now? Okay. The thing that I'd like to say is, whenever we start thinking about the history of racism, I wish you would look at a book called The Color of Law. Now, this isn't a definitive anything, but I don't know if you've ever heard it. You will see how our federal government, using racial discrimination and good people who helped the federal government to take all of the racial discrimination and discriminatory things and continue them from the state level to the local level. I lived that, and I couldn't believe that I was living it as I read this book. I said, oh my gracious, I still live in that same community that was isolated from everyone else. So whenever you start thinking about how this came about, you have to go back in your history and see how it was formulated, so that then we may be able to look at it and bring it to another level. We can change things if you know about it. Now, a lot of times we don't know. Earlier, I know someone said, Oh, I didn't know you didn't want to say people of color. Whenever you say people of color, it's nice to put everybody in that same basket that have color, but everyone has color, as Jane Ellis, I think her name is, as she talks about. But whenever you throw everyone in there, then my needs are generally washed away. And I don't know, I've mentioned it in a meeting before, and I know people looked at me like, oh, you don't like that particular term. No, I never have. I am a Black woman. I am an African American. So my needs are different than someone else who has a different background and a different culture. One of the things that today, whenever you were talking about what you had done to reach the elder community or the older adults, is you said, oh, we put information in the Latino, in the Asian, something else. But no one said that you tried to reach out to the Black community, and that was just today. So I think we need to really just kind of look at everything that we're talking about, everything that we're doing. And if it's a serious effort, the serious effort will work out. Yes, Blacks are dying at a higher rate. And I do have, I have a caregiver support group that I started. And the caregiver support group met yesterday and just talk about the things that were issues for them. We have also 2 Black psychologists that join us from time to time. And I guess we're really, really fortunate to have them because they listen and they every once in a while say something to add to our pain or our suffering. And so we're pretty good in that space, except that people yesterday, one man needed, how can I keep, my wife is falling all the time. She fell getting up to go to the bathroom in the middle of the night. What can I do? Those are issues that affect everybody, but it's affecting him as a caregiver for his wife. We were able in that group to get him some help so that she could get rails for her bed, so that she can get to another walker. Those are things that you just don't hear about. And you just don't, unless you have the issue, you don't even think about it. I didn't think about it until yesterday. So we have to continue to work on our issues. And just because I approach it with the passion that I approach it with, doesn't mean that I'm angry or doesn't mean that there's something wrong. It's just, that's the way I approach it. I'm 76 years old. The same thing that's happening now happened in the 60s. It happened again in the 80s and 90s. So now we're in the 2000s and it's happening again. It happened with my mother and my father. So I hope that the love that everyone is feeling for each other is genuine and that we can pass this time in our lives so our kids can take the mantle and not become James Crow Esquire, because then we're back in the same situation. That's it. Thank you.
Thank you, Cheryl. Anyone else would like to add any thoughts, perspectives?
Hi, this is Donna. Can any, I know my internet is unstable, so I'll make it as short as possible, but obviously I'm, sitting and listening and feeling this has been a very rough time for our family caregivers, and particularly for our African-American caregivers, as we reach out to them. One of the things that I think that also is compounding, besides what's going on with our, the regular systemic racism, is that for the caregivers, they're now also living in multi-generational households where there's some they're having children, and they're with our older adults, and people are trying to protect the older adults and trying to find ways so that everyone stays safe. But it's more of a challenge when we have households where the kids are there, you know, now it's summer and people can't care in the usual way. So we're hearing those kind of challenges even more among our caregiving populations in the African American Black communities. So, and Cheryl alluded to it, and everybody has, you know, already talked about, we already know what's been going on for generations in our community. So that's all.
Thank you, Donna. Anyone else?
I just want to echo what Cheryl has just said about the historical context of racism in this country, and that it is absolutely, there's been a separate set of books for African Americans, a separate rule book for how African Americans have been treated in this country since the beginning. There's a book called Stamped in the Beginning, which outlines the entire history, and we're still living with it, as Cheryl just mentioned. And I hope we're looking at the historical context as well as the cumulative impact to health when we are making recommendations for the master plan. That's all for me.
Thank you, Kara. Anyone else?
Linda's been raising her hand.
Okay.
Hi there, Linda with the California Pan-Ethnic Health Network. Just want to echo, you know, all the comments that were shared already, and I just wanted to uplift, you know, what was said earlier about, you know, like cultural competency and that, and just language access not being the end-all be-all, but really investing in our community partners who can do that trusted message relaying. I think that's really crucial, especially right now. And Leandra mentioned, you know, a lot of these community-based organizations, you know, they're on the front lines doing a lot of this mental health service delivery. So I think one of the strong recommendations that we would have is we really need to make sure that those organizations are resilient and have, you know, the financial means necessary to do this work. Obviously, in this COVID era, everything's online, everything's virtual, and a lot of these mental health services were conducted in very communal settings. You know, some examples are very clear with the California Reducing Disparities project, which is a project that conducts pilot programs to serve the most vulnerable and underserved communities. And these are community-based organizations who are meeting the needs of folks on the front lines who don't get culturally appropriate care in a very Western medical setting. And so just ensuring that those folks, you know, are equipped with, you know, computers and with, you know, if they need extra phones, just that kind of like physical infrastructure, but then also too that they have technical assistance to help inform and educate their clients and their community members about like how to use Zoom, right? Or how to like access like WebEx and things like that. It requires so much work on these organizations who haven't had to do that in the past. So just ensuring that they're resilient, that they can do this work and not interrupt the community and the care that they're providing. So just, yeah, addressing the digital divide there. Another thing that CPEN is working on is we're circulating a sign-on letter right now calling on the governor to really you know, declare racism as a public health crisis. I think as folks had mentioned earlier, this COVID pandemic has only made a bad situation worse. You know, none of this is new, but it's just really exacerbated the disparities. And we can't ignore the fact that racism is responsible for a lot of the poor health outcomes we're seeing. in addition, failing to address that is not really going to create long-standing success, no matter how many, recommendations we make. If we're ignoring racism, nothing's really going to stick. So yeah, I'd be happy to share that letter with this group, or if that's something that, individuals or organizations, would be willing to sign on to, we would love to really build the base of support for that. And then the last thing that I wanted to share is just the importance of data collection. As we know, it's very evident that, Black Americans, African Americans are suffering really the brunt of this virus. And I think one of the things that CPAN has been actually partnering with Justice in Aging on is kind of looking at disparities within the skilled nursing facility space. From what I understand, they report out the total number of deaths or cases, but it's not broken out by race and ethnicity. And I think if we really want to be intentional about who this is affecting the most, we really need to ensure that data is properly reported out, so we know how to target interventions. And then one last thing, sorry, I promise this is the last thing. One thing we're hearing too is, contact tracing is really one of the key tools to reopening and reopening safely. If we have a strong contact tracing program and really asking folks to isolate and, take care of themselves, we know that in, I want to say, Madera County, they're conducting their contact tracing program with the sheriffs. And if we know anything about community trust, we really need to be deputizing our community partners. I mentioned the community-based organizations who are doing mental health support, who are doing grief and loss support. I think those are the folks that we really need to be training to do very culturally appropriate contact tracing work, because we know that if we have law enforcement conducting it, we're not going to get good feedback, and we're not going to be able to really reach the folks who need this service. And then secondly, just kind of piggybacking on that, ensuring that, if folks are identified to have been in contact with someone who's been infected, making sure that they have the resources and support to properly self-quarantine, especially if they live in like multi-family households and things like that. Just telling people that they have to do all of these precautions and then not giving them the resources is only half of the solution. So yeah, just wanted to kind of offer up those thoughts.
Thank you, Linda. Good point. Any other comments?
I just want to sign on to that. I want to sign on.
Sure.
Great. I'll send it over. Maybe I can send it to Kim, and then we can share it out.
Okay.
Great. Thank you. Anyone else? Kim, anybody else raising their hands? I can't see.
Hi, this is Jeff with Latino Coalition for Healthy California. Yeah, I just wanted to share some actions that we've taken and kind of our perspective. So when the COVID-19 pandemic first hit, we did a survey of our community partners, multiple regions across the state, and we developed a Platica series on Facebook Live, so having conversations with community members in language and culture, and really a conversation by Latino advocates across multiple issues that we had identified in the surveys, everything from mental health to food security to economic and the economic stimulus checks and the governor's immigrant resilience fund. So that was really an opportunity for us to shift for our one-on-one community engagement to a virtual platform, and there have been a lot of learnings with that. And I think for those of us in the nonprofit sector, there's still continued financial resources and technical assistance to be able to shift our programming from in-person to a virtual platform. We also developed, and this was a a month-long effort. We developed a letter that we circulated to the governor's office on Latino priorities for COVID-19 that really focused on rapid response, kind of ongoing needs related to COVID-19, and long-term recovery and resilience. So really looking at this as an opportunity to shift some of our programming in the state to really think about long-term financial sustainability for our communities. I think for us, one of the things that we've learned is how important data is, just to document the scope of the problem. In the initial data reports, we were contacted by media, and it looked like Latinos were doing better than white Californians. And we asked, we need more data, and we need it broken down by age and some other indicators. And no surprise, once CDPH published the data tables by age, we started seeing those disparities. We are a younger population, so the under 17 really masks some of the inequities that we see with our older adults. At every age group above 18, we see both higher cases and higher death rates than our representative of the community. So I think for us, the data piece is still important. Something like 30% of the data is still missing, so we don't really have a full picture of what's going on. That being said, what's playing out is what we expected. So for the Latino community, we are in those low wage occupations, and we're disproportionately represented. And so we're more likely to be in situations where we may be in contact with COVID. And so for us, we see this as an opportunity. The whole kind of framing around who's an essential worker is really important to us. So agricultural workers, those of our farm workers, folks that work in trucking and kind of logistics, folks that work in restaurants. And I think this is a good opportunity for all of us to really use this as an opportunity to uplift the dignity of work, and think about supporting our low wage workers. And for the work group here, I'm thinking about our caregivers and who our caregivers are. We have many of our caregivers in the aging space are immigrants. Many are undocumented, and so we want to continue to uplift that. And then also just to flag, another issue that's come up is the issue around how Latinos are ourselves, very similarly to the United States, Latin American countries also experience both colonialism and genocide of Native peoples, but also slavery. And so we have a large Afro-Latino community here in California. So, kind of the intersections of that, and thinking about how the erasure of both Black Latino people and also Native and Indigenous Latino peoples. And so we're trying to think through how we can do better as an organization to uplift racial equity, within our organization. And then I'll also just finally add the ongoing issues that existed before with our immigrant community around the chilling effect of federal immigration and anti-immigrant policies. So to Linda's point, we're very concerned with contact tracing. If the state and counties don't invest in CBOs and trusted messengers, whether they be promotores, community health workers, we really need those trusted messengers, because our communities are already, we already have seen a decrease in the use of services, whether it's healthcare or social services. And, this pandemic is only exacerbating that. So we really need to support that and think through kind of that strategy moving forward.
Thank you, Jeffrey. Any others? Anyone else?
Yes, hi, it's Marcy Edelman. Can you hear me?
Yes, go ahead.
I just wanted to follow up on data collection in COVID. Let everybody know that today, I believe they'll be voting on SB 932, which would require reporting by local health officers to DPH to include sexual orientation and gender identity. We have not as yet any data collected, COVID data that includes sexual orientation and gender identity. And my understanding is a good chance that this bill will pass, and then we'll go on to the assembly. And I'm hoping that we might want to all consider supporting that legislation as it comes up in July, if it passes today. The other thing I wanted to mention was to follow up on SOGI data. From 2015, there was legislation where several departments, state departments, were mandated to collect SOGI data, and the only department that has done that with any success has been the Department of Aging. So the other departments have been sort of lagging behind. And we were hoping, I was working with Assemblyman Chu's office to perhaps do an audit this May, but then COVID came and that pushed that out of the way. So hopefully we can get back to taking a look at how we can move these other departments forward in collecting data. And then lastly to say, this is the 50th anniversary of Pride. And what I'm proud to say is that almost all the Pride celebrations around the country are focused on Black Lives Matter and elevating the voices and lives of Black LGBTQ folks, seniors especially, to the forefront of the community. And as I think as allies, what we all need to think about is resources and directing resources within our own communities to programs that support the health and economic security of Black folks. Thank you.
Thank you, Marcy. Any more comments? Well, hearing none.
Thank you. Yes, thank you, Rigo. And I would like to thank all of you for bringing so much of your experience and your thinking and your strategy to this in your heart to this conversation. There's a daily agency call about COVID, and I had let them know I'd be reporting back from this meeting. So I will be writing up, I'm up to 15, but I probably didn't get them all, but an immediate report back tomorrow to agency of the priorities that were expressed. I'll do my best to bring those forward. Although I encourage this group to think about whether, it sounds like lots is happening, but whether more formal communication should happen as well. And then of course, there's things here that CDA can do immediately in terms of being clearer about our strategies and communication around African-American communities and families and anti-racist strategies. So thank you for that feedback. We are committed to doing better, so appreciate that very much. I think we'll also circulate some of the resources that were shared, including the Color of Law, Stand from the Beginning, Karen Franklin's Wall Street Journal piece, etc. We've been talking for a while about having a home for some of these places, so we'll start with email, but whether we can build that out to our anti-racism work and communications. This is incredibly helpful. I think what I'd like to do with our time, let me pause there and see if there's any comment to kind of that sum up and next steps. It's an impossible hour to sum up, but it was incredibly valuable. And I hope you all are seeing, there are 35 attendees here. I'm seeing across the community, across state departments, across the legislature here, benefiting from this conversation as well. What I'd like to do with our remaining hour, 55 minutes, and I'm not concerned at all. I know it's different than the paper agenda, but this was the most important conversation to have. The next part is really about figuring out how we get some very important bodies of work done. So honestly, we'll spend a few minutes kind of surfacing it, but really the goal will be to identify the key people who can do the work offline. Those of you who are already active, Donna well knows from LTSS and research and other places, the real work happens offline. So let's start the conversation, but know that with this short time in this new format, we'll be looking for people to take it out. I believe, so we're gonna do two things, and then of course we're gonna save time for public comment at the end. The first thing we're gonna do is revisit this equity tool. That great work had been done. I believe Carmen and Rigo are Carmen Gibbs from the CDA team, who's been leading our equity work, and Rigo are going to continue this conversation, sort of where we are, some suggestions to add to it, and then how we can finalize it very quickly and deploy it even more in the field. Carmen, Rigo?
Go ahead, Carmen.
Okay, thank you. So just want to thank you all for being here. It was a wonderful conversation. I'm really glad that we were able to have it. I think the main thing that I got from the input that you provided is that there's so many challenges, and they're not new. They're not new challenges. So what we're trying to do at this point is turn those challenges, like Jeffrey was saying, into opportunities, very real opportunities. And I think the first one that we created were these equity tool questions at the very first meeting. And we take these very seriously, and we appreciate all your feedback thus far. We've looked at these questions 2 to 3 times now, this equity work group. And so hopefully we can finalize them to inform all the other work groups and subcommittees. And I think Amanda is going to put the updated questions, because we've been continuing to work on them for a while now, and up until yesterday, we've just added a couple more questions. Okay. So we have 7, basically I call them question sets. We have 7 question sets, I believe, and about 6 of them we've already looked at. You've provided your feedback. 1 is new that you haven't seen and So I'm just going to go through them very quickly. Well, not quickly, but we're just going to go through them so you understand what we're looking at, and we're any feedback is greatly appreciated. As we spoke about, we're trying to have it finalized so other groups can use this by June 30th. So the first one is, how are these recommendations to the MPA going to acknowledge the needs while building on the strengths of the community in culturally appropriate and inclusive ways, right? And then going forward, is equity integral to these recommendations? What does it mean, and what does it look like, and embody and provide examples? Because what we really want to do is make sure any recommendations that come out of the MPA, that go into the MPA, are equity based. And so that's where this is really coming from. Is equity integral to all these recommendations? Thirdly, what are the basic needs of the communities that we're trying to meet, and are they met in a culturally appropriate and inclusive way? Is key information such as access to services, forms, teaching materials, social media, phone lines, are they available in language and in culture? If not, what are the plans to achieve culturally appropriate and in-language services? Fourth, what are the unique challenges and disparities facing these communities, and how are the challenges and disparities addressed in these recommendations? And this is the 5th, is what we've looked at this before, but we've also tried to meet the moment, and we edited it a little bit. So originally, what are the root causes and organizational barriers that we are going to have to address, and are they addressed in the recommendations? What will and can be done to reduce organizational racism? This is the new aspect of this question. What will and can be done to reduce organizational racism in every aspect? This will include staff, volunteers, program services, outreach, supplier diversity, etc. So we did name some things in there, but it's every single aspect that we're trying to address. And this is the new question for your consideration. Given this moment in our history, do the recommendations take into account the effects of systemic racism? how do the recommendations ensure that systemic inequities surfaced by COVID-19 are addressed, including those affecting monolingual, LEP, low-income older adults, and those without access to internet services. And lastly, which hasn't changed, but we wanted to put the systemic racism question first, and this is all grounded in data. So the last question is, how does the data research inform or support the recommendation, statement, strategy, or conclusion? Which communities were included in that research, and was the research conducted in a culturally appropriate and inclusive way? So those are really the questions that we would like your feedback on, to make sure that we're going to get to the result that we want and the purpose of why we're all here.
Thank you, Carmen. And I just want to add that, again, these are questions that have been developed over time with through our collective efforts, and have been shared with all of you. But obviously, between the last time and now, much has happened and reflected by the comments that were made. And so I want to make sure that within those comments that you have made, that that thinking and your thoughts are embedded into these questions. And if not, certainly love to hear your thoughts if there are gaps within these questions in particular.
Mm-hmm.
Hi, this is Karen. I went through these questions a couple of days ago, and I think overall, the question that I had was, how needs would be determined, or who would determine those needs? What would be the sources of information? So are these, consumer-driven needs? Are they consumer-centered? Like, who's going to participate in identifying what these needs are, right? And what some of the solutions, recommendations might be. And so I think having a conversation about the stakeholders and the different constituent groups that would comprise those stakeholders to begin to identify what these needs are might be a point of consideration.
Good point, Karen. Thank you. Other thoughts? Suggestions, recommendations?
I just wanted to mention, since Karen said what she said, when I was in the assembly, they came with, some of the advocates came with a list of things that was like a Bill of Rights for older adults that were in facilities. Well, whenever you look at the Bill of Rights, it said that I think one of the questions, or one of the topics, was the food choices. Would that be something that a person could come back and say, well, they didn't provide the food? Or would the person who had the nursing home say, I provided the food and it was good? Whenever you look at all of our questions, you have to look at it through the lens and through the eyes of others. Now, if I went into a nursing home and tasted some of the food, it would not be to my liking. I'm sure there's others the same way. But that particular Bill of Rights went into effect and I supported it. However, when you look at it, there's two sides to the coin. So I think that we need to look at through the lenses when we're looking at these questions, look at it through each of our lenses to see if that is, if it's okay for us. That's all.
Great point, Sharon. I'm wondering, Kim and others, if you have thoughts, to Cheryl's point, could that be also drawn, or could that opportunity be had perhaps where we have interactions utilizing these questions with representatives of those particular groups of goal 2, goal 3, goal 4, similarly to the interaction we had with the LTSS work group, you know, where we actually had that exchange dialogue. In some ways, we didn't have these all built out, but we utilized some of these or these questions in that exchange.
So, oh, Kim, go.
No, you got it, Carmen. Go ahead.
So I was going to say, we do have liaisons for all those goal groups that it's going to be coming up later. And so those, there have been volunteers from this equity work group that are to work in goal 2, goal 3, goal 4, research and data with the town hall that have graciously volunteered from this equity work group. So they will be able to have that dialogue, Rigo, that you're talking about, which is very important. So I think that is that opportunity right there. And then also to Cheryl's point, can we move up a little bit, because I did skip over this. So we don't have a full Bill of Rights, but I think I did not set the kind of the introduction right here. And this is the purpose of the MPA. We wanted to older Californians across the lifespan, and we talk about different racial and ethnic groups, disability, geography, income, immigration status, language, religion, faith, sex, gender identity, sexual orientation, and family status. And then these are the guiding questions to review the recommendations. Because of what's happened within, in this moment, we did highlight a question about systemic racism. But I appreciate your point, Cheryl, about we want to get those perspectives. So that's really important.
I have a question. This is Rita.
Hi.
Go ahead, Rita.
Given our conversation, the only thing about these questions that I would say is that all of them seem to be very well structured, except number 2. So the 2 lines actually should be 1. And rather than is equity integral to the recommendations, for us to make a point to say, since equity is integral to the recommendations, what does it mean and what does it look like? I think in this group, the issue of equity being integral to all the recommendations is a moot point. And I think that we need to start there. That, we're here, and the purpose was to look at this, and the answer is yes, equity is integral to the recommendation. So what does it mean and what does it look like? Rather than is equity. I don't think there's a question anymore.
That's good. That means we've come a long way since we first met. So yes,
excellent point.
Thank you. I'm sorry, I just wanted to add one more thing. Thank you, Rita, for that. I absolutely agree with you. So, I think about Audre Lorde's quote, "The master's tools will never dismantle the master's house." And when we're talking about equity, I'm thinking about a current conversation that we're having right now that's sort of taking hold for the first time. It's not a new conversation again, but the idea of defunding the police, right? So there's, a debate between police reform and defunding the police. And I see police reform in the spirit of equity, in the spirit of addressing inequality, which has to do with the distribution of resources being equal, right? So it really is, improving community and police relations, sort of reviewing current policies and making sure that they're fair and people are being held accountable and police in particular are engaging in safer, responsible practices. So that's an issue of equality. I get that. Equity would be more like defunding the police, right? Equity involves a redistribution of resources based on the need of a particular community. That's a completely different conversation. And so I think when we're talking about an equity tool, you know, we need to have some transformative language here. In addition to examples of what that could look like, right? Are we working within the existing structure and sort of tinkering with the edges? Or are we talking about some transformative reorganization, restructuring, redistribution, whereby we can achieve equity? Not that we can actually go that far, but what would it look like, right? And I don't know if people who aren't really clear about the difference between equality and equity would be able to come up with solutions, even to use this tool and as a metric, and weigh it against these recommendations to determine whether or not these recommendations are in fact achieving equity, if people aren't quite sure what it could look like. So maybe at some point, you know, having a conversation around what is equity and what that look like, because it is a little bit more significant than the current language, because I think in general, the current language is really an issue of equality, in my opinion, versus equity.
Thank you.
Yeah. This is Rita again. So I think that was very brilliantly articulated. It seems to me, in my participation in this group, what I would seek as ideal would be equity. Given our current status in California here, my best hope for the immediate future is some equality. But the equality has to be based on the vision of equity. In other words, that it is a step toward equity, that it may not achieve equity initially, but that is our goal. So I'm going to use an example of, when I went to Cuba, there's a doctor in every neighborhood. Now, they have problems with their health system. It's lots of long waiting for significant procedures that need to be done and stuff. But they have a doctor in every neighborhood to which the neighborhood people go. Now, that's something transformative to me. I'm not recommending that we do that here, but that is an example of looking at the system that we would like as opposed to the system that we have. And we just need to make sure as that we begin to build toward equity, that the equality steps do not create a freeze frame of the current situation, that it is always with the mind that we are going to equity, that we do the next steps. You know, it's like, okay, I can't get there now. You know, I'm not capable of running a marathon, but I can do a 3-miler. But the purpose of doing this 3-miler for me is to begin to train for the marathon. So I'm not going to do a 1-miler. That's not going to get me anywhere. You know, I'm going to have a progression of steps. So I'm glad you brought that up.
So Rigo and Carmen, I'm wondering if we can either you have the initial feedback you need to take this offline and land it. Perhaps a separate call is needed with people who are interested to work through more of this. Certainly some more drafting is it sounds like, another round. If you're looking for a couple other volunteers, I know Carmelita's interested, but not here today, of course. Where would you like to go from here with this, Rigo?
Well, I think we could, Carmelita, Kevin, and I, and Carmen, we could all regroup, right, and really quickly think about how we redistribute. We send this back out to the folks, give everyone here the opportunity to actually add your perspectives to these questions. What was the proposed deadline, Kim? When do we need to have this done by?
Well, the proposed deadline was Tuesday. The goal is to get it to the other work groups as quickly as possible, but you know, we want to get it right. So,
Yeah.
and we can also do versions. I think we want to be in dialogue with what's the right quick process to get it as strong as possible. So open to dialogue.
Yeah, I think I'm going to borrow a little bit on what sort of Karen and Rita were sort of working towards, and that is, let's take some incremental steps towards getting where it needs to be. And so in that process, I think we'll work quickly, but I think, you know, gathering what we have, putting it back out there, hearing back from some of you, and perhaps even going as far as having a call with a small set of people who, you know, with regards to some of these revisions or additions that they made. That's just sort of top of mind.
How does that sound to the group?
That sounds pretty good. For me,
I'd like to add something.
Go ahead. Go ahead.
For the new language about given this moment in COVID-19, I think it's really important that we spell out that what we're talking about is historically anti-Black systemic racism. If we don't say what we're talking about, we're not going to address it. As well as with all of these recommendations, we need to identify specifically the populations. If we're not identifying those populations, we can't get to the answer that population needs.
Mm-hmm.
Agreed.
So historically anti-Black systemic racism, that's what racism in this country originated from, anti-Black beliefs.
That's one point.
It's Catherine speaking. I just wonder at the beginning when you're sort of outlining things, if it isn't worth sort of some of the things that were just mentioned saying, which is, this is to be transformative. The goal is for equity. I mean, just to be explicit about where we're going, and these are some steps to get there. But I think particularly as this goes out to others, people aren't going to have the benefit of a really phenomenal discussion, and to try and capture some of that in this intro piece before you get to here's the things you should look at would be quite powerful.
Mm-hmm. And to that and building on that, the strong intro reflecting, if the slides could come back up and we could go to the table that shows the membership of equity work group in all the other work groups, that liaison role that Carmen spoke of. So we'll work on the document, but there's also this liaison piece where, and Catherine, I think we've left you off here. There are people on equity who are also in these work groups. So I can go in goal 1, it's Donna, but I believe it's also Catherine, so forgive us. In 2, Cheryl Brown and Karen Lincoln. Goal 2 is beginning to work again this summer. We will make sure that, I believe you're already included in those conversations with Nina Weiler-Harwell convening that group, but make sure that connection is made. Similarly with health and well-being, Marty Lynch and Maya Altman have been beginning to convene, so Jeffrey and Edie should be part of that. Goal 4.
And Leandra.
Okay, thank you. So this chart is missing a bunch of names, so let's take that back and get that corrected to make sure we have like exactly Leandra's on there, Marty's on there. So forgive us, and well, that's one of our action items is to correct this.
Kim,
Yep.
this is Ben. These members are, Leandra, thank you for being a member of Goal 3. These are members that are not we're not on the goal groups to begin with, and therefore are added equity work group members to serve as liaisons. We know that there are a number of members who are on both subcommittees, and we're really grateful for that. But these were just particular, like, additional folks who were added, who were not originally webinar leads, or like Kevin as the goal for work group leader. You know, those are members that are cross-sectional.
Okay, so it's not so much that needs to be corrected. I'm going to ask for a broader view of this. so that we have both, as you said, the people who are on both and people who are going to be added who are not on SAC but be added. And just to continue running through, Goal 4 has not yet begun meeting, so you haven't missed anything yet. They're coming. And of course, the research subcommittee has been meeting and has a meeting in July, and I think I did both there. I see both there. And then the public engagement, we had talked about, we were all planning to have you may recall, a Master Plan for Aging town hall in June. That was postponed because of COVID, and we're reconvening with really a focus on ageism and ageism with an equity lens, looking for that intersectionality that many of you have raised, and working with Shireen McSpadden and the Meta Fund to bring that lens to that program. So coming soon, July 29th at this point. So Rita had volunteered. So we will make sure we have all those right. But to your point, Catherine, we're hoping both the document can carry forward the conversation, but also people who are in both places. And if you are not connected yet or are not sure if you are, please reach out to Amanda, our project director, or other of our team to make sure everyone's in the right list. So if I could, I would like us to pivot, going to try to keep moving us through our business to yes, we have the tool. Yes, or we will have the tool. Yes, the tool should infuse every single recommendation that comes forward. And also, there are likely a space for equity-specific recommendations, whether they're cross-cutting, whether they're foundational, that we believe this group should drive and shape and bring forward. So here's a proposal to react to, just again to keep us going, is that the equity group would identify a few leads who would work on putting forward what are the equity recommendations, those transformative recommendations that this group wants to bring forward to SAC. Ideally, you would work on them this summer, July, August. We could meet again in July and August as needed to finalize, but then really they're done by the end of August so that they can come to the last SAC meeting, the September meeting, for presentation and discussion there. Many things have come up that could be included in our discussion of COVID, but obviously that would come from you all. Everything from things for the plan to transform, also for implementation strategies. And again, we're very much mindful that the equity work group is a body that was created for this master plan process, which will be ending as a planning process and thinking through what is the new equity structure institution going forward for aging and disability, whether it's at the department, the agency, et cetera, but what is the right structure? So many questions that we'd like to see, and really this is a new process here, so we really want to open the conversation. I think, Kevin, you were going to help frame it and facilitate it so we can leave with some next steps.
Yeah, great, and I think you just framed it perfectly. So we can open it up straight to what people think of this process. I'll say I think this is a good process. We just have a few minutes to discuss it. And I think it would be great if we end our discussion today identifying that small group that could do some of the substantive work and also maybe outline a process by which that small group would bring ideas back to this full group to get more input and hit the deadlines that you have outlined here. So I like this idea, and hopefully in the next 5 minutes or so, we can get input on it, modify it, and get some people to volunteer to be part of the small group. So what do others think?
So this is Karen. I like the process and I volunteer wherever it makes sense for me to be involved.
This is Derek. I really like the process too. So please count me in.
This is Kiara. Count me in.
Same here. This is Edie.
This is Mario. Please count me in.
This is Rita. Please count me in.
Hi, this is Marcy. Count me in.
Hi, this is Donna. Count me in.
This is Cheryl. You can count me in.
All right,
Leandra.
our small group is turning into a big group. Leandra, I got you.
Well, you know what? I can do something else.
I
Let
appreciate
somebody
the
else.
enthusiasm. All right, and we appreciate the enthusiasm, but we're expecting that everybody's going to contribute here. And we've got now a good list of names of people that have volunteered to be part of that small group, which is going to have more work to do. And happy to take others too, just if you know, we have a pretty good group here as well. So I don't want to discourage anybody, but I also don't want people to feel like they need to continue to add on because we've got a good group here now.
Well, Kevin, just in terms of process, you know, I can specifically speak to what I think I'd like to contribute in terms of the language around equity and what that could look like in terms of strategies, et cetera, sort of moving from this idea of equality to equity and what those steps might be. But if people have, you know, really specific ideas about where they'd like to contribute in the set of recommendations, maybe that might be helpful since we have more people who are interested. And then we can see, you know, where those specific, you know, interests are and how they could be applied to the recommendations.
Yeah, that's a great idea.
I would like to say, I think I would be very interested in contributing a lens of the Olmstead Act into the discussion regarding people with disabilities. Just to build on Karen's idea of equality and moving towards equity.
Right.
Thank you.
So Kevin, did you take me off or did you leave me on?
I left you on for now, Cheryl.
Oh, okay. Because I just have just one or two things whenever you meet to talk about when it comes to equity and equality. Mm-hmm.
Yeah, that's great. That's great. And I think that, go ahead, Rita. Yep.
My contribution would be in the area of transforming large systems, as we did in the field of alcohol and drug abuse and child welfare.
So Kevin, it's Catherine. I'm not volunteering to do this, and I'm actually was really pleased that Marielle raised the question around Olmstead. But is there one of the observations I have in the disability system more generally is that Black and Brown people are often more institutionalized or in the most restrictive settings, in more restrictive healthcare settings than others. And I guess I'm interested in whether that data is available and where that might lead as one's thinking about equity, because it often means there aren't equitable service systems in the community that are culturally responsive, et cetera. So I personally just think it's important to, you can't sort of figure out where to go if we don't have data that helps us understand what some of the problems are. So it'd be great to have.
Yeah, that's great. On that question, we just saw some data that showed that among older adults, there's been more of a shift to home and community-based services for white older adults and less so for Black and Brown older adults. So there's at least some data that's confirming your experience.
Yeah, that seems seems to be my experience.
Mm-hmm. So maybe we could, I like the way Karen kind of framed it of what people can contribute. We probably don't have time to go through all that today, but that could be a first step for when we gather our group. People can bring to the table in advance of whatever that first meeting happens, ideas about what they can bring, and that can help to guide the work of that group and conversations of that group. Again, the intent of that group is to deliver on some of these very equity-centered specific recommendations that I think Kim said could span from the ones that Karen might put in the equality box versus the ones that we would put in the equity box. And I think that it's a great opportunity to put a little bit extra expertise behind that equity conversation and what would be the transformative ideas that this group would put on that get to equity. So the group I have now, and if you want to be added, you can also email me later, and I'll take some responsibility working to with Ken's team to set up a series of calls for this group. Now I can't read my own handwriting. Leandra, Cheryl, Karen, Derek, Kiara, Edie, Marielle, Rita, Marcy, and I have one name I can't, oh, Donna. I couldn't read my own writing. So thanks to all of you. And I know we've got to move to public comment here too, Kim. So I think we got where we needed to be for today with this work.
Excellent. Yes, we've got farther than I thought we might. So thank you very much. We were hoping to do an update on data and research because this has been such a priority of the group from the very beginning and continues to be a priority. In the interest of moving to public comment, Terry, do you want to do a 30-second update on what the slide already says about how the data dashboard is underway with CDPH and West Health?
No. What I'll say is that I really have appreciated the discussion here today and the reinforcement of that data priority and the research priority, and just want to highlight for everyone that the research subcommittee does have 2 remaining meetings where we're going to be talking about both what measures we do have that can illuminate some of these issues and help inform future efforts and make sure that we are making the progress that we want to make, as well as exploring how do we get better data? How do we fill in what we know are major gaps in the data that we have now? And some of those have already come up around, for example, the COVID data, where we have, we do have data. As you see here, this is a little dated. You can go to the website to see the most updated information. We do have data broken down now by race and age. However, as you see with the highlighted items there, there's about 30% of the population of people who have confirmed COVID diagnoses that we don't know what their race or ethnicity are. And that's, I'm highlighting that as an example of the types of gaps that exist pervasively throughout our data picture. And so one of the things that we would really encourage the equity work group to focus on in conjunction with the research subcommittee is that set of questions. How do we improve our data over time? What kind of recommendations can we put together to improve that picture? So these are the kinds of questions that we want to make sure that we're taking into account, and so encourage all of you as you're thinking in your ongoing equity discussions to also think about the crosswalk with the research and data pieces as well.
Thank you. And again, we again heard that the data on SOGI has gaps from Marcy, and the data around residential facilities and SNFs, as Linda raised, has gaps. So as Terry said, this is one example where more and better is needed. With that, I would like to move to public comment and let Maria tell us how we will do that. We'll do this for about 10 minutes and then we will wrap.
Sure, yeah, so attendees who are joining by phone, if you press *9, that will kind of indicate to us that you have your hand raised and we can open your line then. And if you're on Zoom, there should be a raise hand feature on your toolbar. Looks like we do have a couple of folks with their hands up. Jeffrey, I'm gonna open your line. Jeffrey, there you go.
I've unmuted. This is Jeff Tartagia. As a year ago, I offer to you the remark that without your consumer, the individual, the senior there, you often do neglect that. I participate with the Office of Emergency Services now and in getting involved with that. And for the disability community, and is what's going on with this COVID-19, that the virus has an impact that's different related to the individuals, not only age, not only racial, but also from now, even now identifying it's even with blood type. So equity and equality, as we're also having that discussion taking place in the theme of racism, is also something that how you make things equal, how you involve yourself for the matters for what you need in the master plan of aging, is still missing. And you are trying to address it, just like having to get emergency services to identify that, hey, in the data, this is missing about race and about where the equal impact that's going on. This has been an interesting discussion to hear you talk about. I will have to go to another meeting that's going on with housing and racism that's going on. But I also heard an offer that the COVID-19, please listen to some of the lectures going on there, because the information is coming in finally to understand more of the things. The next issue of equity that you have to relate to is dealing with the possibility of vaccines, because who is going to get it? Another issue that affects the consumer, affects the individual, and I haven't heard anything about that in the nature of dealing with equity in there. That's my public comment to you today.
Thank you, Jeff. Next.
Next we have Betsy. Betsy,
Hi there.
you've got your line open. Yep.
Hi, it's Betsy Butler. I'm the chair of the California Commission on Aging and also the executive director of the California Women's Law Center. And I just want to take this opportunity to say thank you to everyone on this call and everyone who has worked so hard to get back everything we needed funded in the budget. And I especially want to thank Kim for that, because I cannot imagine how many sleepless nights you had, Kim. And I'm hopeful that last night you got some rest. So I'm thankful. We haven't gotten the budget signed yet, of course, but I'm just so thankful for all the work that everyone has done to get us this far. It's so critical. It's so important. We are so blessed to have you all, and Kim in particular, working on behalf of aging Californians, and I'm just so grateful that we are where we are today, and I hope it holds. So thank you again.
Thank you, Betsy. Next we have Teresa Ogan. I hope I'm saying that right. Please feel free to correct me. Teresa, your line's open, but you're self-muted.
There we go.
Yep.
Thank you. Yes, this is Teresa Ogan. I'm the site director of 2 MSSP sites, serving 4 counties, and I also serve as the chair of the Site Association for MSSP. I want to thank also the committee for supporting our community-based programs for seniors. We're really hopeful that they're going to be signed with full funding in the budget. And I would really request that there's ongoing support from this committee and the full committee to support these programs. We work really hard to serve our diverse communities in whatever ways fit their needs the best. And I think that they are invaluable when we have this conversation about providing services that are culturally appropriate. And so I'm just asking for ongoing support and thanking all of you for the support that we have had.
Thank you, Teresa. Anybody else? Just going to pause a couple of seconds if you have a comment.
I wanted to ask Jeffrey about housing and racism that he was just mentioning. Is he still on?
Yes, Jeffrey, your line's open and you're muted on your end.
Am I talking now?
Yes.
Okay. At 12 noon today, the Sacramento, the UCC system of speakers format is going to have a UCLA professor discussing with racism. If you want to get a hold of Brooke at that center, you might still be able to get in. If you can send me, if you can send me your email, or Kim, if you know how to send my email, I can forward it to Brooke. And that's starting at 12 noon today, 10 minutes from now.
I would like to make sure that they understand the history of racism and housing in America. And I've been just doing the research on it recently.
I will send to Kim. She should have my email address when the presentation is over. I usually end up with a copy of it, and I can send it back to you of what was presented by a UCLA professor related to housing and racism.
That's wonderful. I appreciate it. Thank you very much.
Anybody else? Okay, Kim, I'm going to pass it back to you.
Thank you. And actually, is there anybody on the equity work group who had another comment before I sum up where our next steps are? I did push us through the last few minutes, but I want to make sure if anyone wants to add another comment, there's time and space to do so. Okay, then. This has been enormously helpful to me in thinking about the plan and thinking about CDA. We are finalizing our strategic plan, and we, in fact, just decided to be bold and use the word transform. So you all are inspiring me that that was the right direction to go for the aging strategic plan. So thank you on many levels. But in terms of immediate next steps, I will be reporting back to agency, which includes public health, healthcare services, and many of my sister departments. Much of this feedback from language, from data, mental health, providers, the focus on translation as equivalent to cultural competency is right on. So thank you so much for that, reporting that up. We will also be doing more to do on CDA's continuing COVID response to make sure we are hearing you and taking your strategic direction. We will circulate many of these resources and also continuing to find a home for them, from articles to books. We all have a lot of learning to do. Many of us have a lot of learning to do. Then in terms of master plan, Rigo and Carmen and team will do a quick process, but a thoughtful process to land those questions, and at least in a 1.0 version that can then be handed off to the work groups. Second, Amanda and I will make sure that everybody knows the cross members, the liaison members, so that you are fully included as group 2 and 3 and 4 research do their work, that we have that connection, deep connection to equity work group as well as the tool. And then third, we'll get this, we tried to make it a small group, but we'll see, Kevin, a large small group of the equity work group to do some writing together and thinking together on recommendations, using Karen's great suggestion to crosswalk with particular areas of interest or expertise to fill out that picture. So Kevin will help us organize that work. So that much will get done. And then the notion is that we will reconvene in August in this format to formally finalize those recommendations to go to the SAC in September. That's the current plan. Let me pause. Anything missed, need to be added or clarified? Well, again, thank you for creating the space and coming to this table with all that you did bring today. It was enormously helpful and invaluable, and we will take it forward. And so grateful more than ever for the partnership and that this body exists and that you are serving and leading in this way. Thank you all very much.